So I want to make this abundantly clear. If that night, if there was a co-responder program, without a doubt, without a shadow of a doubt in my mind, Sonya would still be here today.
We know that research published by the Department of Health and Human Services state that every dollar invested in substance abuse disorder treatment saves $4 in healthcare costs, $7 in criminal justice costs. We're talking about housing individuals in jails that cost anywhere from $38,000 to $60,000 a year in person. And when people are brought to emergency rooms, could cost anywhere between $2,000 and $4,000 per visit by the taxpayers. So we're talking about real savings that could be invested in other programs or programs that don't need to be cut when we're balancing the budget because of all of the money that has had to be spent on incarceration or medical visits.
This is Justice Voices. Sontae Massey, Adam White, welcome to the program.
Thank you for having us.
Thank you for having me, man. I really appreciate it.
Sontae, you were a commissioner on a Sangamon County commission that was established called the Massey Commission, and it was named after a cousin of yours, Sonya Massey. Tell us who Sonya Massey was, and tell us her story. What happened to her?
Well, thank you once again for having us. I will tell you that she was a mother first and foremost. She was a sister, a cousin. She was just like everyone else. She lived every day to make sure that she was taking care of the people that she really cared about. Sonya, I had talked to Sonya that day, and something was a little off. I know she was a little worried about something. And so I made sure that, you know, she was okay when we got off the phone. And she suffered a lot. She was dealing with lupus. She was semi-retired. And her biggest joy in life was cooking for her children and making sure they're okay. She was just a regular person. She spent most of her days making sure that her children got off to school, making sure their grades were okay, taking care of her lupus. She spent a lot of time with her mother and my mother as they lived together. And, you know, she was just a great, great person.
On the day that she was killed, she called for a police response and was actually one of the police officers, a Sangamon County deputy sheriff, who shot and killed her. Tell us about that as you understand it. Now, some of this was recorded by the body camera worn by one of the deputy sheriffs who responded. And I think I know people all over the country have seen this, and it's traumatic. Tell us what led up to that.
Well, so she had called the police, I believe it was around 12:30 a.m. She was hearing noises outside of her home, and she was at home by herself. Her son was supposed to be there that night, but he opted to stay with friends, and she was okay with that. So she was in her home alone, and she started hearing noises in the back of her home, and she said that she heard banging on the back of her home, and so she called the city police, and the county responded because of I believe zoning issues, and so you have to imagine 12:30, 1 o'clock in the morning. Sonya was about 5'4", 110, 115 pounds roughly. And it was, you know, it was very late in the evening. And what it showed me on the video is that she was afraid to answer the door, but she knew that she had received help. But she was still a little leery about people knocking at her door at 1 in the morning.
Then what happened?
So she wanted to make sure that she was complying. She was trying to lighten the mood with the officers. I think she detected at the door that there was some hostility there, but she knew that she had to make sure to accommodate the police. Now, that's something that we learned in our family, to make sure that we're kind and polite to anyone that shows up at our house. And, this in particular was the police showing up at her house. So she wanted to make sure that she complied. She tried to de-escalate once it became the feeling became a little hostile. She was asked to go take a pot off of the stove that I believe she was cooking, something to stay up and wait for the police. And, she was asked to go take the pot off of the stove, and she complied. And then she was trying to she had an attempt at humor, I believe. And he took it a different way, meaning Sean Grayson. Sean Grayson took it a different way. And he said that he was going to shoot her in the effing face. And once he pointed the gun and stepped in front of stepped in front of Dawson Farley,
his partner,
it became real to her. So she apologized, and she was, in my opinion, she was trying to shield herself because he had already threatened to shoot her in the face, and then he advanced towards her and did just that.
Now, you mentioned this pot of water or pot of something was boiling. She wanted to take it off the stove, so it appears in the video. She had it in her hand, and this was somehow played a role in the decision by Sean Grayson to shoot her in the head, shoot her in the face, and killed her.
Yes.
He was subsequently charged with murder and convicted of murder. I've heard you say that you are convinced that Sonya would be alive today if there had been a co-responder who had responded to the scene with the officers.
So I want to make this abundantly clear. If that night, if there was a co-responder program, without a doubt, without a shadow of a doubt in my mind, Sonya would still be here today. That would have ensured that the police would have followed proper protocol, and she would have certainly felt more comfortable.
Describe a co-responder program. What is that?
Well, early in the video, I think he announced the code for, mental health patient. And so that is a trigger. If in a perfect world, that would be a trigger to send someone out that deals with mental health issues. And I think that it would have de-escalated itself. I believe that co-responder would have de-escalated the situation and ensured that all parties were safe.
If we had a co-responder program, Sonya would still be here, and I unequivocally believe that. There's not a doubt in my mind that if a licensed clinical social worker would have been on the scene, Sonya would still be here with us.
And we've had here in Sangamon County, which is where Springfield is, where we're talking right now, Springfield, Illinois, there have been other instances where people who are undergoing some sort of a mental health crisis or episode of some sort, police or first responders have responded, and things have gone badly, and they have died in one way or another. Now, why don't we have a co-responder program in Sangamon County?
Well, I think that's the $1 million question. I mean, I ask myself that every day. Why don't we have a mental health commission or mental health respondents? available at all times. I think that, in light of a lot of things that have transpired in the past couple of years, the defunding of mental health services around the world, particularly in the United States, I think that we have suffered as a result of it. So I think that, if we bring some of these services back, and we're just saving a lot more lives and ensuring that people are safe and secure.
After the murder of Sonya Massey, a commission was formed here in Sangamon County called the Massey Commission. And you were a commissioner serving on that, correct?
Correct.
And there were, as a result of information that was gathered, testimony that was gathered over the course of an extended period of time, there were not recommendations, but calls to action. And call to action number 9 is the sort of things that a mental health board would do if it existed in Sangamon County, correct?
Correct.
Which is the topic of the referendum, because it doesn't exist. And the reason for that is because there isn't the money to fund it. I'm going to turn to you in a moment here, Adam, to talk about that a bit. But you are now, Sontae, you have shifted from being a commissioner on the Massey Commission to being a staff member in the Massey Commission, correct?
Correct.
And what is your role?
So I'm the associate director. I am learning the tricks of the trade, so to speak. I think it was important for the family to be hands-on when it comes to making sure that these initiatives pass, make sure these initiatives are heard. And the biggest issue with the family, obviously, was mental health and making sure that everyone was able to receive mental health services if needed. So we had 26 calls to action. I believe that the mental health initiative was established very early on in the Massey Commission because it was one of the most important initiatives. We had a lot of easy wins, so to speak, that we wanted to address before, certain things that we can address easily, but the mental health portion of it was paramount, according to the family, according to the commission, and I just think that that was one of the things that we pushed for very early on. And we have to remember, we came up with 115, 120 calls to action. So the 26 that we focused on this year are specifically for this year. We want to move forward with other initiatives as well. And
those are going to be the topic of some future episodes of this program. Adam, let's turn to you. There were actually 2 commissions that were operating in parallel with one another concerning these mental health issues. One was actually appointed by the Sangamon County Board, the Sangamon County Mental Health Commission. And their job, as I understand it, their role was to study the issues involving mental health needs and resources, or lack of resources, that is, here in Sangamon County, and make recommendations. In parallel to that was the Massey Commission, and you are a member of the staff of the Massey Commission. So talk to us about these 2 boards and what they concluded on this topic.
Absolutely. So the Massey Commission was tasked with identifying gaps in services across many different sectors. So we looked at economic disparities, we looked at mental health disparities, we looked at law enforcement disparities, and community education, because there are a lot of programs, a lot of resources available, trainings available, but the community just doesn't know about it. So we wanted to make sure that we tackled the educational component as well as mental health, law enforcement, and economic disparities. Because if you want to solve a problem, you can't look at one issue. If you're really interested in solving a problem, you have to look at it holistically, because there are a lot of different factors that come into play. It's not just one thing. When Sonya was murdered, it was a failure of the entire system. It was not a failure of that one particular officer over anything else. That officer failed miserably, but it was the entire system that failed Sonya. It was not just one thing. So we were tasked with looking at the whole system as the Massey Commission. And then the Mental Health Commission was built off of our recommendation that mental health services have to take priority in what we're going to address. Law enforcement kind of folds into that, but the mental health desert that we live in here in Central Illinois had to have been addressed. And that Mental Health Commission more identified that one specific entity of mental health, our healthcare ecosystem, because mental health is healthcare, right? But how does that whole ecosystem look in Sangamon County? And then they were tasked with identifying, if we were to create this mental health board, this commission, where would they start? Where are the biggest gaps in our services? Who are the people who fall through those cracks the most that we need to start with? Identifying those populations were a big component of that commission, but also to understand of like how that commission operates, like what are the budgetary years? Are they planning in 1, 3, 5-year cycles? Kind of the nuts and bolts of the Mental Health Commission when it gets created by voter referendum. But the goal of the Mental Health Commission was to identify specifically the gaps in healthcare and mental health care, and how we could address that. And the Massey Commission looked at the entire ecosystem, which mental health was a component of.
And this is what I'm getting at. There were 2 commissions recommending, both of them, the creation of a Sangamon County Mental Health Board.
Yes.
Is that right? Now, what is the difference between having a mental health board in Sangamon County versus the status quo, which is no board?
Absolutely. Great question. Very important question. So the Mental Health Board will identify different sectors. And when I say sectors, I'm for a couple of examples. We could talk about intellectual disorders. We could talk about youth programming. We could talk about substance abuse disorders. We could talk about like very serious conditions. One that we learned about were the lack of resources for schizophrenic patients, people dealing with schizophrenia. There are next to no resources here in Sangamon County for people dealing with that condition. And that is something that it's not something that you wake up with one day and you're like, maybe I feel it, maybe I don't. It's something that they have to live with that for the rest of their life. And there are no resources and no programming here to help them. And that is just one example of the whole ecosystem. And I think that the importance of this board is to kind of shift our funding model, because we have a lot of great programs here in Sangamon County, and I don't want to discredit the people who have been doing this work for a very long time, because they have been doing it with little to no resources, and doing the Lord's work. So I don't want to discredit that, but I think where we're seeing is so much of our funding is contingent on grants, and that's fine when the money's there, but what happens when the money's not? And when your funding sources are predicated on people who are either residing in the White House or the governor's mansion in Springfield having the same values as you and prioritizing the budget to reflect those values, leaves you kind of in limbo, hoping that the people in charge value the same programming that you do. So what we're trying to establish here is a core funding block that will support these programming concerns that we have, these gaps that we have, without the need of consistently relying on federal or state grants. Now, that is to say there's a caveat, because there will be a grant writer on staff for this, provided this commission passes and gets established. There will be a grant writer on staff that will be responsible for getting state and federal grants. But where we're trying to draw that line of distinction is the programming can't be solely relying on grants. There has to be a core funding mechanism, and that's where this sales tax comes in, because it can raise $14.7 million on our loose estimates. So we're talking about $15 million for core funding, not contingent on grant cycles or anything like that, private donors, which we still will be soliciting, private donations and going after grants, both federal and state, but the programming won't be, the success of the programming won't be necessarily based on whether we get grant funding or not.
Your point about not relying upon grant money is well taken, because grants come, grants go. And the same thing is true with government funding. It comes and it goes. And so what has been proposed by the Sangamon County Mental Health Commission and by the Massey Commission is to provide this base funding for a mental health board in the form of a sales tax, a small increase in the sales tax. And so could you describe what that is and what that money would go for?
Absolutely. And I just want to start off by saying it's not a blanket sales tax. So I know a lot of people hear the word tax and they immediately shut down. This is not something that is going to be applicable to everything that we purchase. It is a retail tax, and there are very specific goods and services that fall under the classification of retail. But to go over some of the entities that is exempt from the tax, because I think we should focus on what it doesn't cover more than what it covers, is basically like three major lanes. One of them is anything that has to be registered with the Secretary of State. So if you're buying a new car or a trailer, RV, motorhome, those license purchases where you have to register, that's not going to be taxed. So you're not going to go buy a new car and have a $10,000 added tax to the car. Another exemption is what we call medical devices, medical equipment, but that's pretty large encompassing, and that is medical devices, medical equipment, prescription and non-prescription drugs. So, your insulin pumps, readers, things like that, over-the-counter medication, none of that's going to be taxed. And then the third and final lane is very important. Gas is not going to be taxed, as well as what we call unprepared foods. And that is anything purchased in, a grocery store or convenience store, but anything outside of a restaurant will not be taxed. So we really try to identify the what we would consider necessities and luxuries, and exempt the necessities and really try to focus on the luxuries, what we would consider luxuries, and stay away from things that people have to buy versus things that people might want to buy.
So, for example, if somebody goes and buys groceries, that's not subject to this proposed sales tax.
Correct.
And if somebody goes and buys new clothing, that would be.
That's correct.
Now, how much of an increase in the sales tax are we talking about? So
this is a half cent on the dollar. So it if we're talking about, what does that actually translate to on $100 purchase, it's 50 cents extra. 50 is 25 and 10 is 5 cents. So, you're going to spend $10, you might see a 5 cent increase in your sales tax.
Well, let's talk about other counties that have mental health boards. In fact, there are 95 mental health boards already operating across 66 of Illinois' 102 counties. Is that right?
Yep.
So the Sangamon County is actually an outlier, and is an example of a similar tax. Is Winnebago County up in Rockford.
They have a half cent. Yep.
A half cent increase in sales tax for their mental health board, created a mental health board. And as I understand it, they saw a 60% decline in emergency room visits as a result of that, added 165 behavioral health positions. Can Sangamon County look for similar, not necessarily the same scale because the counties are different in their size, but are those the sorts of outcomes that we could expect if the voters approve this 0.5% sales tax increase here?
Yeah, absolutely. And you know, we modeled a lot of what we did off of Winnebago because Winnebago County has been so successful, and it's comparable to Sangamon County as well. They just renewed, they have a sunset, so they have to renew their tax every 5 years, and the voters just overwhelmingly approved it because of how great those services were actually starting to impact the community. So if our question is, will we see those same kind of services here and see those services have the same kind of impact that they did in Winnebago County? I would be more than willing to unequivocally state that it would. You know, we're talking about an extra $15 million for core programming. And this is not something that's going to be dictated by the Sangamon County Board. And I want to make that very clear because there are a lot of people who have concerns about the current administration on the board having that kind of money and being able to spend it how they want. That is not the case. The county board will not dictate how that money is spent. The county commission, the mental health commission, and the commissioners that comprise that board will make those decisions.
Okay. I don't want to slip into the commission was this temporary. The Sangamon County Mental Health Commission was a temporary organization that made the recommendation for a Sangamon County Mental Health Board.
Yeah. Yes, the board, when it gets formed, because we're going to speak that into existence, when it gets formed, they will dictate where that money goes, not the actual Sangamon County Board. So Chairman Van Meter and his board will not be deciding where that money goes. It will be the professionals that make up the 708 Mental Health Board itself will decide where that money goes.
Now, I think there are going to be most voters when they go to the polling place. One of the things that's going to be foremost on their mind is if we're going to be paying more in sales tax, we want to make sure that there is going to be a return on that as an investment. And in fact, there have been at least a couple of studies, large-scale studies, that have indicated substantial savings as a result of this sort of funding of mental health services. So on the one hand, yes, there's an increase in sales tax, a very small one actually, but it can save a lot more in costs overall. Would you address that?
We know that research published by the Department of Health and Human Services state that every dollar invested in substance abuse disorder treatment saves $4 in healthcare costs, $7 in criminal justice costs. We're talking about housing individuals in jails that cost anywhere from $38,000 to $60,000 a year in person. And when people are brought to emergency rooms, could cost anywhere between $2,000 and $4,000 dollars per visit by the taxpayers. So we're talking about real savings that could be invested in other programs or programs that don't need to be cut when we're balancing the budget because of all of the money that has had to be spent on incarceration or medical visits.
The Sangamon County Mental Health Commission that was investigating this, as I understand it, found that only 17% of service providers here in Sangamon County consider current mental health services to be adequate. And they found in that survey that 40% of Sangamon County residents reported an unmet mental health need in the last 3 years. And 89% expressed support for increased county funding for mental health. So, Adam, with public support for adequate funding for adequate mental health resources in Sangamon County, what can you say to those who still remain skeptical when they go to the voting booth?
I hear you. Someone who is very skeptical of the government doing the right thing. I hear you, but I also hope you take into consideration that while this is a government founded board, its composition is not political. These commissioners who will make up the board are professionals, people with lived experiences, people who do this work every single day. They're not politicians. They're not campaign operatives or anything like that. And this is so greatly needed across so many different communities, sectors. I mean, we talk about veterans, youth, our rural communities. Like, this is so desperately needed. And as it was alluded to earlier, out of 102 counties, these operate in over 90, right? This is not something that we're trying to do. This is not new. We're not trying to break the mold. We're trying to catch up, and we're trying to provide services that will save lives. And that alone is enough why we need to pass this. We're talking about lives. We're not talking about numbers. We're not talking about budget lines. We are talking about that, but that when we're translating, we're talking about people's lives. And a half a cent on a dollar is a very small investment when we're talking about lives and making sure our community is healthy. Because if we constantly talk about making sure that our law enforcement officers are healthy, what I don't understand is how they can be healthy when our community is not. And if our community is not healthy and our community is hurting, the people who are operating in that community are not going to be healthy and are going to be hurting as well. So if our community is healthy, our law enforcement officers and everybody who's going to be operating within that community will be healthy. So I really hope that we kind of switch that way we look at things. And while we need to prioritize law enforcement because they're risking their lives, we need to make sure that the communities in which they operate are healthy, vibrant communities, and stop looking at it like we need to fix and make sure the officers are okay, neglecting our communities, instead of saying, let's make sure our communities and our families are healthy and thriving. Then whoever operates in that space is going to be thriving as well. So if we could just shift that mentality and start thinking about, how do we make our community healthy? How do we make sure that people who are hurting the most have the resources that they need and understand how to utilize the resources that we have? We have a lot of resources, but people don't know how to utilize them. They might be afraid. There's a myriad of different reasons why, but not having this is hemorrhaging our ability to heal and move forward and become the healthy, vibrant community that we all know we can be. So when we're talking about the importance of passing this, think about this. 60% of people who responded to that survey said that they deal with mental health concerns internally. They never talk about it. I mean, 60% of people, and that's probably a slight underrepresentation of the actual number of people who are walking around dealing with something that they're not talking about. That's not okay. And if we have avenues and people to help connect people to services and have enough resources for the services to encompass everybody, we can all start healing and doing better. And I don't know how to say that a half a cent is such a small investment to make sure that we're all doing okay.
In fact, as I understand it, the county board made up of elected officials, both parties, Republican, Democrat, voted unanimously to have this proposition, this referendum on the ballot here to fund a Sangamon County mental health board.
And that might be the only thing that they've ever unanimously voted.
Agreed.
So just keep that in context.
Unanimous. Sontae, The commission's final report says that Sonya called for help and received harm. If this referendum fails and nothing changes structurally here in Sangamon County, what's your concern about the next person or the next family that reaches out to law enforcement in the midst of some sort of mental health episode or crisis?
Well, that's a heavy question. I think that I've said it before in public, and I will say it again. This wasn't even the first time it happened in Sangamon County. This will happen again if we don't address it now.
Now, speaking to our listeners who live in Sangamon County and who will be voting on March 17th on whether to enact this sales tax to fund a mental health board in Sangamon County, let me tell you that I am voting yes. I urge you to vote yes. Now, some people may not vote in this being a primary election because they say, well, I'm an independent, so I'm not voting for either Republican or Democratic candidates. You don't have to. You can go into the voting area and you can request a nonpartisan or referendum-only ballot. Vote, and I urge you, vote yes.
Vote yes.
Vote yes, please. We need it.